Good afternoon, and thank you for joining us. This week you've heard a lot about mass testing of students and teachers as school starts back. I wanted to give you a little bit more background on how that plan came about and where we are now. Earlier this year, and in partnership with the Memphis City Council, we allocated $12 million from the Federal CARES Act funds assigned to Memphis for enhanced COVID-19 testing. Of that $12 million, the City Council approved the initial $2 million for a pooled testing pilot. Dr. Manoj Jain, who is available by phone if you have any questions, really opened my eyes one day when he talked about the two people who tested positive in the White House a couple months ago. And he told me that was a good thing, because it alerted everyone that those two people who were not showing any symptoms were positive with the virus. And if they didn't test, they wouldn't have known they were positive, and they could have spread that virus to others in the White House. So the importance of testing rang true to me, and I started reading more about colleges, Notre Dame and University of Southern California, talking about when they entered school in the fall, they would do targeted mass testing of students and teachers. So here we set up a program. How do we build a program from ground up, scientifically that made sense, and logistically? Scientifically, we were faced with great tests that were really accurate, but they cost a lot of money, well over $100. Well, Dr. Jain and Jim Sweeney and others informed me about pooling. And Dr. Jain is here to answer more questions about it, and Jim Sweeney. But the pooling method combines multiple patient samples and runs a test on all those samples together, meaning you can test more and for less cost. If the result is negative, all the samples in that test are cleared. If something comes back positive, each individual sample is then run individually to determine who may be positive. The FDA needs to approve pooled testing for each individual labs. And as we went through that process this summer, I want to thank our congressional representatives, Senator Alexander, Senator Blackburn, Congressman Cohen, and Congressman Kustoff, who all advocated for Memphis and Shelby County to the FDA to get those reviews done quickly. To find out exactly how to implement the plan operationally, we created a testing committee that meets virtually 3 times a week, and we started testing with our own city employees first, without pooling, before pooling was approved, in part to test how we can operationally do mass testing. After a few successful internal rounds of city employees and some children in summer programs, with parental approval, of course, we expanded the pilot to include teachers and are currently in the process of adding, on a first come, first served basis, schools that are open for in-person learning this fall semester. Tiffany Collins with the city is in charge of that operation, and she'll talk a little bit later. As of right now, we have the capacity to test up to 4,000 students and teachers per day, and that number hopefully will grow over time. I want to make it very clear that we are not recommending in-person versus virtual schooling. What we are saying, if a school goes in person, we are offering them another tool like masking and social distancing and good hygiene. This is just another tool if a school decides to do in-person lecturing.